everyone. Welcome to Cancer Watch, a public health program on cancer awareness brought to you by the Commod Cancer Foundation in partnership with the Association of Radiation and Clinical Oncologists in Nigeria, proudly sponsored by Plus TV Africa. My name is Dr. B. Yolutunde Olusegun, your co-host and the ACRON representative. Dr. Dennis Ejo is not on the program with us today, but we will definitely be having an educative time regardless. Please remember, today's episode could be the conversation that saves a life, maybe even yours. Our topic today is Skin Deep, the skin cancer truth. Please do us the utmost favor and share, follow, and subscribe on YouTube, Instagram, Facebook, and let's get the message across and keep helping people get informed, and by so doing, we can save lives. So did you know that skin cancer is becoming more of a growing concern globally, particularly even in a country like ours, Nigeria? There is evidence that there are almost 66,000 new cases annually, and unfortunately, quite a number of these cases present too late even for a disease that is quite visible early on. The conservative statistics is that almost 2,000 people die in Nigeria annually from this largely preventable and curative disease. This may look like a small number, but it certainly won't seem so to anyone that is affected. So today we're going to try to do a dive into skin cancers and shed light on the truth about it. And to help us do justice to this is a vibrant and hard-working consultant oncologist, Dr. Gaddafi Yusuf, MBBS, FWACS, who is a consultant radiation and clinical oncologist and head of Department of the Radiation and Clinical Oncology at the Federal Teaching Hospital, Katsina. He also serves as the interim chairman of the Katsina branch of the Nigerian Cancer Society. Dr. Gaddafi Yusuf, you are so much welcome to our program today.
Welcome, Dr. B, and hello, viewers. Welcome.
Thank you, Doctor. You look good. How is Katsina? I hope everything is fine.
Yeah, everything is fine. The weather is okay. Yeah.
All right, so let's just jump into it right away, Doctor. The month of May is Skin Cancer Awareness Month globally. That's one of the cancers we're supposed to be talking about in May. And I guess this must mean it's quite a huge concern for there to be a global day, month, for making awareness about skin cancer. Please can you tell us what exactly skin cancer is? And is it really true there are several types of skin cancer?
Yeah, you see, Dr. B, skin cancer is an uncontrolled growth of skin cells, which result from DNA damage, and this DNA damage will lead to uncontrolled growth of these cells. And these cells will grow abnormally beyond the normal repair mechanism or the normal control of the body. And then these damages usually result notably from ultraviolet radiation, and which could occur as a result of exposure to sunlight. And sometimes for people that use tanning beds, these damages can occur to the DNA. And by so doing, these damages, if they occur, they will cause uncontrolled proliferation of these cells. And these cells, if they are in an uncontrolled manner, they can also invade the local structures, and as well could extend to go into the distant structures like the lungs, the liver, the brain, and even the bones. And if you see, Dr. B, skin cancer globally is one of the most common cancers of all forms. So therefore, there is need for us to talk about skin cancer. They are classified into melanoma and non-melanoma skin cancers. But the non-melanoma skin cancers are the most common, and these are usually composed of basal cell carcinoma, the squamous cell carcinoma. The basal cell carcinoma is usually a slowly growing cancer that rarely metastasizes, but however, it can cause a lot of disfiguration to the body, and especially when it occurs around the facial region, it can be very discomforting to the patient. And then if you look at squamous cell carcinoma, as compared to basal cell, is highly aggressive and usually can metastasize to the lungs. And then you see it even going to the brain and other structures. And then for melanoma, which is usually less common among all these ones, is highly aggressive. In fact, it's very notorious in the sense that if it occurred, it can metastasize so early to distant structures. Notably, it can go to the lungs. It can also go to the brain, giving the patient what we call hemorrhagic brain metastasis. So these are some of the types of cancers that can occur within the skin. But however, as we know, the skin also have other structures like the lymphatics. So we can even have the lymphoma of the skin, what you call lymphoma cages. And then we can also have cancers that can affect even the sebaceous glands and even the hair follicles. So these are some of the common cancers that we can have within the skin.
I would like to deep dive a bit more into the risk factors for developing skin cancer. What are these risk factors? Who is at risk of developing skin cancer and why?
Okay, like I said, most common form of risk factor in developing skin cancer is the ultraviolet radiation, which is usually comes from the sun, which is natural, and then we can even have an artificial source, which is from the tanning beds. But however, you can also, for people that are light-skinned individuals, they can be more at risk of developing skin cancers. And for people that have white eyes, they can have more at risk of developing skin cancers. And then for people that have multiple moles within the body, just bumps within the body, if they are multiple and they are atypical, they are more at risk of developing skin cancers. And then if we go back, some people may have personal or family history of even skin diseases. If you take maybe like family history, we can have what we call familial atypical multiple mole melanoma syndrome, which is a syndrome that can be familial. If someone has that syndrome, he's more at risk of developing skin cancer. And then for people that usually stays under the sun or use the tanning beds, they have more exposure to ultraviolet radiation. We can also have chemicals like arsenics that can predispose one to developing skin cancers. And then you see nowadays people have changed their lifestyle. Everybody, even if you are dark, you want to look white. You see people have been using a lot of lightening creams. And those lightening creams could change someone's, the skin having a natural protection against that ultraviolet radiation, especially in us black that have what we call melanin, which is produced by the skin. It reduces the penetration of that ultraviolet radiation into our skin, causing damages to the DNA that can predispose to developing skin cancer. So if a patient or if an individual is using those lightening creams, it can also destroy that protective ability of the skin, and this could predispose them to developing skin cancers. And then as we age, you see, as people are aging, that aging is also another risk because we see more cancers coming when someone is aged. So in a nutshell, these are some of the risk factors that one could develop skin cancers.
Okay, thank you so much. That's really good to hear. I mean, I'm surprised that this natural sun that we have, is something that we need to be worried about. And from what you're saying, people who work for long in the sun, farmers, market women and men, and anyone that is truck pushers and all of, maybe even drivers, perhaps they need to pay a little bit more attention. Is this so?
Yeah, they need to actually, because around 10 a.m. to 4 p.m. that's when you get more sun, and that's when you get more ultraviolet radiation coming from the sun. So for people that are being exposed, and you can't tell people not to go for walk, not to go for their normal activities, but however, they need to get protection using sunglasses that can protect them, and also wearing protective clothing that can adequately protect their skin to prevent them from that exposure. And then you can use even hats that can be able to protect one from having those sunlight exposures. So I think it's good that people that are going, you see police officers or those traffic officers that are
even students, Dr. Gaddafi, even students, yeah?
Yeah, even students, one need to at least get some protection, because if you are exposed, you don't know when the DNA damage would occur, and if there is not any repair to that damage, this could lead to one developing skin cancers. That's right.
Yeah. Right. Thank you, Dr. Gaddafi. So you did highlight a lot that light-skinned people, albinos, and so on and so forth might be at risk because there's a protective layer of melanin in dark skin colored people like yourself and myself. But someone is at home watching this and saying, I'm dark skinned, so I'm spared from this illness. Are people who have darker shades are still at risk of some forms of skin cancer?
Yeah, there is this misconception that goes into the society that when you are dark, you are immune from skin cancers. No, not really, actually. Because, we just got some, at least, what do I call a protection from the UV light entering into our body by possessing that melanin. But however, it's good to know that in dark people, even if they have skin cancer, it's usually worse, because it's actually late. It's what could I say? It's the development of skin cancer in dark people. You see that it will take a longer time before one recognize that there is a lesion in within the skin for him to get to the hospital. So when dark people are not really immune, when you are dark, they usually get the worst part of skin cancers, because it's usually it will be an ongoing changes within the skin that one did not even recognize to get to the hospital. So being a dark individual or a dark complexion doesn't mean that we are immune from skin cancers. We will also get all the exposures from tanning beds, and more so, people may have immunosuppression from HIV, from whether if someone has a transplant or kidney transplant, and all those things can predispose one to developing skin cancers, not necessarily from the UV light, the ultraviolet lights that we get exposed from the skin and tanning beds.
Right, great. I'm really glad you mentioned about immunosuppressive illnesses like HIV. I was going to follow up on that, but you have mentioned it, so I think people in that category should also be careful. We're going to go on a break right now. Don't go away, just stay right where you are. The program will continue in just a minute with Dr. Gaddafi Yusuf doing justice to the truth about skin cancer. Thank you. Welcome back to Cancer Watch, and thank you for staying with us. Together we fight and together we win. The conversation with our guest, Dr. Yusuf, is continuing on the real truth about skin cancer. Dr. Yusuf, let me ask how people can identify what a really suspicious skin issue that can be cancer. How do they recognize it? You had mentioned earlier that sometimes in dark people it can be seen too early, and then we have so many skin issues. People have vitiligo, people are born with a mole or birthmark. There's something we call amyolo in my tribe, Yoruba, just like drops on your body and things like that, needles and all sorts of. So how do we? What can be cancerous? What does it look like? How do we recognize something serious on the skin?
Yeah, that's an important question, Dr. B. I think usually most of us take any lesion within the skin for granted sometimes. But however, it's good to always check there are some important things that we need to know about changes that could occur within our skin, or any lesion that we see in the skin, that this lesion looks suspicious actually. We have a rule which we call the ABCDE rule of lesions that are within the skin, that if we see anything, any changes with what I will mention them, if you see them within a lesion in a skin, I think this lesion looks suspicious. That is what we call the A, which is asymmetry. You see, you look at the lesion and see that one half of that lesion doesn't match the other, meaning that it is a bit wider than the other side. So any change like that you see in the skin, it looks suspicious actually. And then plus the border, when we see that the edges of that lesion becomes an irregular, rubbed or black changes, then we have to be worried. It means that border that you see changing means that there is something going on within that lesion which is suspicious. And then we see that the color, if we have a color change, a lesion can appear as red, and then if you start to see changes within that lesion becoming darker or becoming scaly, or any changes that we see in the color of that lesion, when we have the diameter of that lesion being more than 6 millimeter, people take it as the diameter of an eraser of a pencil. So if there is any change that we see the diameter of that lesion that we noticed in our body changing or increasing in size to more than 6 millimeter, then we have to take that lesion as a suspicious lesion. And sometimes we can have some evolving lesions. We have a lesion and then we are seeing some patches inside that lesion, or we are seeing some changes or darkening or any other thing that evolved within that lesion that is abnormal from the previous lesion that we saw. This one looks suspicious. And sometimes we can see that we have an ulcer. Not necessarily this one is more with melanoma and melanomatous skin cancers. But however, in other lesions, when we see that a lesion is a non-healing lesion or is developing some fleshy-like nature, or we are seeing some scales within that lesion, then we have to at least be cautious about lesions. So these changes are what we see, that not always that when we see a lesion that we think that lesion looks benign, but we should look out for those changes, and then we should be able to present early to a doctor, so that at least a dermatologist, so that at least some examinations and other things can be done to that lesion to ensure that this lesion is not cancerous. If it's benign, then fine and good. All the measures will be taken to treat the benign lesion.
Wow. Okay, thank you. It's such a beautiful, a very simple way to remember with the ABCDE. A for appearance, B for borders, C for color, D for diameter, and then E for evolving. Like there's some changes. So anyone who has any pre-existing moles or whatever lesion that happens to be going through this probably needs to see a doctor. But our skin is visible to us a lot every day. And why do you think people are still presenting with late diseases for skin cancers? I mean, you mentioned sometimes it's pressed in the lungs, it's pressed in the liver. I'm just wondering, why would something quite visible to you result in a late presentation, and how can we ensure that people are coming early?
Yeah, Dr. B, like I said, for the dark skin complexion individuals, usually we don't pay attention to some lesions that appear within our body. And maybe the time that we recognize that lesion is when it grows big. And then so our health-seeking behavior and our attitudes of checking things that occur or checking changes that occur in our body is quite low, because people will be having some lesions. You see a lesion for like 2-3 years. Nobody has, the person has not done anything. Neither has he gone to the hospital. So first of all, we don't usually pay attention to those lesions paying attention to those changes that we mentioned, and also our health-seeking behavior. And some people will prefer to go to traditional to do traditional medications or any traditional intervention before they get to the hospital. So by the time these lesions grow and it's growing, it's usually separate to other structures. Notably, it will start with the local structures, and then before it gets to the distant structures. You see that by that, when you have a lesion that is quite advanced, then the prognosis will be very poor and the outcome is not really good. So mostly people doesn't usually get to the hospital so early, and also even if they get to the hospital, now the expertise that is within the hospital is also part, because you see that to a general practitioner, and if he doesn't know what to do, he may not likely give him. He may be giving him some sort of antibiotics. He may be giving him some antifungals and other things that may not really necessarily work. And by the time that lesion has advanced, before you know it, it gets to distant structures. So going to the hospital early, and also getting to the expertise that is responsible. You see, seeing the dermatologist, and then later if the dermatologist has done all the tests to confirm what type of lesion is it, whether benign or malignant, he needs to send to an oncologist or to send to a plastic surgeon who will by far now, go and start intervention early. With surgical interventions, other interventions do follow. So mostly our health-seeking behavior is actually low, and also the level of awareness. And in fact, that's the main reason for having this conversation, to increase more awareness for early detection and also for prompt treatment, and then we can have a better and a good outcome of such cancers.
Right. Thank you, Gaddafi. Is there treatment available for skin cancer? What are these treatments if they are available? And do we have optimal access within our country?
Yeah, there are actually treatments available, but like I said, depending on the stage of presentation. For patients that do present early, there is need to confirm the diagnosis, whether benign or malignant. And now we are talking about malignant changes within the skin, or malignant diseases of the skin. So as early as possible, there could be some surgery that can be done to excise the lesion to achieve what we call the suction margin, whereby there is no any tumor that is seen, especially within the depth of the tumor, like what we have in melanoma. That breast no thickness is important. So, and then another thing that we can do, there are other things that you can do in terms of cryosurgery, that you can just like a prison of that lesion, especially for early lesions. And then surgeries at an advanced stage, we can have what we call the most micrographic surgery that ensures at least all the lesions are being excised to ensure that the resection margin are usually free of the tumor. And then another thing that we can do, although maybe for all the non-melanoma skin cancers, chemotherapy is also has shown to have effect in them. And then for melanoma, which is usually complex, it requires the use of immunotherapy, which is highly expensive. Just imagine a patient now is getting ipilimumab or nivolumab, which is quite expensive and not quite available in some other centers. So that's why I'm emphasizing on early prevention, early detection of those tumors, and early presentation. For someone that has presented an early state, you see that all you need to do is excise the tumor and also give radiation therapy in terms of either electron therapy or in terms of the photons with the increasing the dose to the surface, since we are talking about skin cancers. So you see all the treatments are available, but however, some are expensive and not easily reachable to some of the patients, because if you look at immunotherapy now, not all patients can have immunotherapy in some of the centers, and also even the radiation therapy is not quite available in some other centers. But quite sure these cases are treatable when they are detected early. They can be curable at the same time.
Right. So thank you, Gaddafi. We're running out of time, but can you please tell us if skin cancer can be prevented and how to go about this prevention?
Yeah, sure. skin cancers can be prevented. Like I've said, there are risk factors for developing skin cancers. Exposure to sunlight, usually from ultraviolet radiation, and then the use of tanning beds. So if people will now avoid sunlight exposure, especially at that peak time, usually 10 a.m. to 4 p.m. when the sun is at high peak. Now we can also, if by any chance we have to be in the sun, then we need to use the sunglasses, and we also use protective clothing, and also we need to also use those hats that can prevent us from exposure to the ionizing the ultraviolet radiation. And then another thing is we avoid tanning beds. This would also reduce exposure to ultraviolet radiation. And also we need to reduce use of chemicals, and also use of this lightening, skin lightening creams and other things like that, because that's what will reduce the protective mechanism of that skin and can predispose us to developing skin cancer. And also for those that have family history of skin cancers, they need to be going for skin examination regularly. And for typical ordinary people, yearly examination of the skin, I think, is important.
Okay, thank you so much for highlighting all these preventive measures. But I would like you to talk a little bit about sunscreen. Does it have a role to play in preventing cancer? Because it's really trending now, isn't it?
Putting sunscreen will prevent us from having exposure to ultraviolet radiations, which could lead to cancer. And we will look smart, we will also look even more beautiful, and we will also protect ourselves. It's all about our health, our health, our health, our health.
So what would be your final remarks to our people watching this about what we've been talking about today?
I'll finally say skin cancer is real, and then we need to watch out, look for those changes that we have highlighted, A, B, C, D, E changes within any skin lesion that you see, and then most importantly, present to the hospital early when you see those changes, so that these lesions can be examined, and these lesions could be tested to see if they are malignant or not. And then you need to get to the right person, especially, see the dermatologist, and then if the dermatologist say, this is lesion is looking suspicious, you can get to the plastic surgeon, or even the dermatologist could test it to see if it's malignant or not. If it's malignant, we don't need to even shiver, or we don't need to be worried. So more awareness, early detection, early treatment, prompt treatment. This is just the answer. And then we need to wear our protective clothing. We need to wear our sunglasses. We need to also avoid the sun in as much as possible, and not to use the tanning beds. Thank you so much.
Right. Okay. Excellent work, Dr. Gaddafi. Thank you so very much. There you have it, viewers. Skin cancer apparently is not as uncommon as we would like to think, and Dr. Gaddafi Yusuf has really highlighted the truth regarding this concerning illness for us, and I hope you have learned a thing or two in this program. Skin cancer is a public health concern, and of course more commonly in light-skinned people, including albinos, but also occurs in dark-skinned colored people too, Thank you so much, Dr. Gaddafi Yusuf, for a most interesting and educating discussion.
Thank you. Thanks for having me.
Right. So you're very welcome. Thank you. So let's keep this conversation going in our homes, schools, and communities, because the more we talk about it, the more lives we will save. So until next time, speak up, check yourself, and stay informed. Let's talk about it, share it, and pass it on. Please follow Commod Cancer Foundation and the Association of Radiation and Clinical Oncologists of Nigeria, and Plus TV, on all our social media platforms, and join our growing community of warriors, survivors, caregivers, and advocates who keep doing their best to ensure that lives are saved every day. See you again next week at the same time. Bye-bye.